Stacey Anonymous, author of the books Don't Be a Stranger and Don't Be a Stranger to Grief. I am here with you today because I've had several requests to do a reading of a constellation of symptoms of post-traumatic stress disorder that are presented in such a helpful and cohesive manner. And specifically what I'm going to read you comes from a protocol called written exposure therapy, or WET therapy as we tend to refer to it in the mental health community. And written exposure therapy is a trauma treatment. It is incredible, it is powerful. I find it to be less invasive than some of the more invasive or intensive trauma treatments that are also incredibly impactful. I just find that oftentimes I have a bit more buy-in, especially early on in treatment from patients, because WET therapy involves writing. It involves a quieter protocol and a quieter approach where my patients will write based off certain guided prompts that I provide them that are part of the WET protocol. I review and read those writings, I offer some reflections and feedback, and we keep going. And so anyway, that's a quick little background on what WET therapy is. By the way, it's put out by Dr. Denise Sloan and Dr. Marx. Really fantastic work. I'm so grateful for this protocol and what it has allowed me to do with the clients that I serve. Now, that said, this video is for informational purposes only, so please do not consider this replacement for therapy or clinically oriented. If you have questions, if you feel like you resonate with the symptoms I'm about to read you, please reach out to your mental health provider. If you're in crisis, please reach out to crisis or emergency services and get yourself help. Let's make sure that you start your journey for healing, if not already. I will say I find WET therapy to be helpful not only with folks with PTSD or post-traumatic stress disorder, also complicated grief, big T traumas that are life-threatening, small T traumas that are still life-changing and life-altering in many significant ways, often can include emotional neglect and things that can be really, really impactful and shattering when it comes to self-image. And so that said, I'm going to jump right in. I'm going to read you the introduction to written exposure therapy again, because it does an amazing job of outlining the constellation of symptoms that typically tend to manifest and show up as the condition PTSD. You may not show up with all of these symptoms, but again, if you do feel like you resonate with a handful of these symptoms, please reach out to a provider and get some help. We definitely want you to feel like you're in good hands, and therapy is one of the most incredible gifts that you can give to yourself. Introduction to a written exposure treatment. Survivors of traumatic experiences often go through changes in their physical reactions, emotions, thoughts, and behaviors in the wake of such experiences. Examples of changes in physical reactions may include increased fatigue, nausea or feeling sick to your stomach, sweating or chills, shock, dizziness, chest pains, trouble breathing, and numbness. Examples of emotional changes may include increased nervousness, fear, grief, depression, hopelessness, helplessness, anger, irritability, feeling overwhelmed, guilt, and vulnerability. Examples of changes in thinking may include increased thinking that your future will be cut short, difficulty remembering things, trouble making decisions, confusion or difficulty concentrating, flashbacks or reliving experiences, nightmares, intrusive or unwelcome thoughts, too many thoughts at once, thinking about suicide, and memory gaps. Examples of changes in behavior may include a startle response or hypervigilance, being withdrawn from others, being overly dependent on others, changes in appetite, sleep, increased substance abuse, alcohol, drugs, medication. This can, by the way, also be food, eating too much or not eating at all, not eating enough, problems with emotional or physical intimacy, inability to trust or have loving feelings, apathy, loss of spirituality, risk-taking, suicidal impulses and behaviors. Each person may differ in the ways in which these reactions are experienced. Some may be very familiar, others not. Many of these reactions become part of the trauma survivor's everyday life. They do not seem unusual to him or her. Take a moment to think about how many of the above symptoms you've experienced since a traumatic event. The manner in which a survivor attempts to cope with his or her trauma symptoms also have an impact on everyday activities. If a trauma survivor has recurring thoughts and memories of a trauma, he or she may attempt to avoid them by using substances, again, alcohol, drugs, food, becoming a workaholic, staying away from other people, or using anger and aggressive behavior to either distract oneself or remove any reminders of the trauma from the current circumstances. And by the way, I do want to add, Substances, you could also add in, or using people, right? People to distract, sexual activities to distract, to numb, to not feel, can be very objectifying. So these are also things to consider in this category. These strategies may give the trauma survivor short-term relief by removing reminders of the trauma from current circumstances, but over the long term can be problematic for a number of reasons. In other words, sometimes a survivor's attempts to cure or cope with reactions to a traumatic event can become a problem in and of themselves. Importantly, approaches that one might use to deal with non-traumatic events do not work well in dealing with trauma. People will sometimes tell trauma survivors to just forget about it and get on with their lives. This approach may work well in many different situations, but one does not just forget about traumatic events. One of the reasons that this advice does not work is that events that are experienced as traumatic are remembered differently than non-traumatic events. The memory of a trauma may be stored in a splintered fashion as a protection from re-experiencing the full impact of the trauma. Consequently, survivors may have amnesia for large segments of time around the trauma, or they may remember some details of the past trauma but may not have any feelings attached to those memories. They may experience overwhelming anxiety or fearfulness without understanding the cause. Certain situations may trigger flashbacks to earlier traumas, and that they might feel that they are actually reliving the past. To successfully recover from the traumatic event, it is important that you confront that experience by recounting it repeatedly in as much detail and with as much emotion as possible. By repeatedly recounting the event, you will be able to correct for the splintered fashion in which the memory may have been stored. You will also find that recounting the experience will result in you feeling like you have more control over the memory rather than the feeling that the memory controls you. So over the series of sessions that then are part of the WET protocol, your provider would be asking you to repeatedly recount the trauma experience and write about that experience. Again, I do want to suggest, please do not try this at home without support of a clinician, because there is a specific structured process for how WET therapy is effective. And we don't want to have the risk of you re-traumatizing yourself and then not knowing what to do with those uncontained emotions. So again, if any of this resonates, if you feel like, gosh, you know what, that sounds like me, reach out to a provider that you trust. Reach out for referrals from your primary care provider, reach out through your insurance networks or people that you trust, and ask for help. It takes so much courage to ask for help, and you are worth it. Bye.